Hello there, I'm Michele Bullock, licensed massage therapist in Washington State, and today we're going to be talking about special populations when it comes to massage and body work and what you need to know for passing the massage and body work licensing exam when it comes to special populations. So we're going to go through a list of potential clients that you have to make accommodations for or be mindful about when it comes to treatment. Now, everybody's got something special about them. I'm special. I know that. But we're talking about clients that specifically you have to be mindful about treating them just a little bit differently without bias or discrimination. So some of those special populations are going to include like pregnant clients, elderly, children, clients with disabilities, athletes, as opposed to someone who just wants a relaxation massage, clients with specific chronic issues, which I can talk about a little bit more in a pathology sequence that I'm going to be going through very, very soon, mental health considerations, effects of immobilization, and like I said, geriatric clients. So we're going to be going through and discussing more in depth each of these. So if that is something that you feel like you need to spend more time learning, then stick around because it pertains specifically to the section in that Federation of State Massage Therapy Board's outline of the exam content under pathology and contraindications. There's a whole section for special populations. So you're probably going to get at least one question regarding how to cater your practice for one of these special sorts of clients. First, I need to talk about the sponsor of this video, and that is my stuff. So I have a bunch of free resources for you. In the description, there's one link, and it will take you to all the stuff. Each of those links in my link tree will take you to each of the resources that you might need for your exam. We have a bunch of stuff that's free right now. It may not be free forever, but go ahead and check it out. So I've got a study guide that goes over more in depth than the Federation of State Massage Therapy Board outline. I have a 100 question practice test so that you can set a timer and go through 100 questions that are all set up in the style of the massage and bodywork licensing exam. There's an answer key at the end of the test that I created that will help you to be able to tell what area you need to spend more time on when you've gone through and checked all of your answers. You're going to learn so much just from taking this exam, this practice exam. You're going to learn so much from everything that you got wrong. So go ahead and take that test. You might do really well. Who knows? You're always welcome to email me. People have emailed me just like, I took your practice test once and I got 89%. Well, good. That's awesome. That's a great sign for you to be able to pass the MBLEx with at least 70%. So that's really great. Also, I have a mini course about how to apply and prepare for the massage and bodywork licensing exam, what to expect on test day. If you don't know anything about that yet, that little course is there. Oh, and the newest thing that I posted, two very, very new things that I posted, my whole sequence of the muscles, muscle mastery, all of the origin, insertion, and attachments for all the muscles that you need to know, region by region on the body, where I go through in the YouTube sequence that I did. I described where all of those muscles are so that you can practice finding them on your own body. And then there's a set of worksheets after that that are attached to each video. I just created a medical terminology ebook, which I'm really excited about. And then a couple of paid products that I have are a bundle of 10 of those practice tests. One of them you get for free already. You get 9 more, so it's over 1,000 questions that you could potentially be getting on the massage and bodywork licensing exam. So you can practice taking the test 10 times altogether, which will dial you into how quickly you need to answer those questions, how to use your critical thinking skills to knock off those and it couldn't be, and help you get through that test easily. It's just a breeze. So I have that 10 test bundle. And then finally, I have a 30-day massage and bodywork licensing exam refresh course for those of you who have only been out of out of massage school for a little while, or maybe you're at the end and you just want 30 days to prep for it easily. It's an audio course, so there's just a little audio segment every day that you listen to, and then there's some worksheets that you can go through to hold yourself accountable and to give you a list of practice activities that you can do to dial in your memory of each of those subjects. So now that that's already all covered, housekeeping is done, let's go ahead and start talking about what you need to know for the special population. So first of all, we've got pregnant clients. They do need special care. During the prenatal phase, we have to make special accommodations, especially after the first trimester. We don't want to leave the clients lying flat on their back because the weight of the placenta with all of its fluid will press on the arteries going down to the legs and the veins coming back up. So we don't want to do that. And we might need clearance for conditions like preeclampsia, placenta previa, or gestational diabetes. So we got to get clearance about that. So side lying for later in the pregnancy, and being super careful not to massage on the inside of the legs, because that can potentially exacerbate blood clots. Postnatal massage focuses on restoring the body after childbirth and regulates hormones. Use gentle techniques when it comes to any kind of abdominal work later in the recovery process, but postnatal massage is so great. So don't shy away from that in the months after the pregnancy is finished, the months after birth. The next section we have is elderly clients, geriatric massage. We use gentle techniques when it comes to our older clients. With the aging bodies, the skin gets thinner, the joints get stiffer, so we can't throw our clients around as much as we can with the younger ones. So adjust your pressure, avoid deep work, avoid too much drag on the skin because the skin becomes more sensitive. Really be careful over bony areas because muscle degeneration will make those areas a little bit more sensitive. The nervous system for aging clients can make it so that pain feels a lot more intense. So yeah, these are all reasons for us to be a little bit more gentle and careful. And then also we have to be mindful of conditions like osteoporosis, blood pressure issues, and any kind of circulatory issues become more exacerbated as our clients get older. So we have to make sure that we're thorough in our intake with geriatric clients to make sure that we keep them safe when we're giving them treatment. So for children and adolescents, massage can support sleep, emotional regulation, and physical development. Use broader strokes as long as the child feels safe, more like gentle compressions rather than anything pokey because they can be a little bit more ticklish. And make sure that the sessions are shorter. Depending on your state, you will either need the parent to be present, or you're going to need to have, depending on their exact age, you're going to need them to at least give consent for their treatment, for them to come in on their own. Just make sure that you encourage a lot of feedback from the children, because often children, just like a lot of adults, don't realize that they have a say in their care. So make sure and open up that conversation early in the treatment to let them know exactly what's going to happen, how long it's going to take, and let's talk about it as we go so that I don't tickle you too much, or if I'm using too much pressure, you feel safe and comfortable with telling me that you need less pressure. Yeah, teen athletes, that's what I've seen the most when it comes to treating people under the age of 18. It's typically athletes or like teenagers that have been in a motor vehicle accident. Growth plates in the legs and arms, we have to be super careful about using too much pressure on those when we're working on helping to free up any tissue on the legs, especially if they've injured themselves with running and stuff like that. We might want to use some deep friction to help break up any kind of adhesions that have been building up in those legs or in the shoulders. But we have to be super careful because their bodies are growing and we don't want to disturb that. So clients with disabilities. So we have a few different areas to explore. Clients with mobility issues. So once again, we have to be mindful not to discriminate. If you're treatment room doesn't really accommodate wheelchairs to be accessible for them, then if you can, try to figure out a way to either get them into the room or to meet them where they're at somehow so that you can help them. Because people with mobility issues benefit a lot from treatment, relieving tension in shoulders from pushing a wheelchair. Backs get really stiff from sitting in wheelchairs. Legs and hips become atrophied over time. So increasing circulation to those areas can bring a lot of relief for them. Be mindful of potential pressure sores, decubitus ulcers. Be careful about those. Don't put any kind of pressure on those. It's a contraindication. Any kind of wound is a contraindication for massage. Work around those. Work around any kind of assistive devices. Make sure you have your communication channel open with that disabled client so that they feel confident in talking to you about the different devices. I've never had trouble with people that had assistive devices being totally cool about shifting their body so that I can work around those devices. Make sure that they're comfortable in positioning. Use lots of bolsters if they need to be partially sitting up. I keep a massage chair around for people that can't lay all the way down, stuff like that. People after surgeries, stuff like that. Autism spectrum disorder is another condition that we might stumble across. I had several clients that had sensory issues on the massage table when I worked in the whiplash clinic. So they have preferences, let's say sensory preferences. So we want to keep that communication channel open with them to talk to them about what feels good and what feels wrong. And don't take it personally that there's something wrong with you as a therapist if the way that you're massaging them, the way that usually works on the rest of your clients, feels wrong to the client that you have on the table that might be on the spectrum, because things can feel very different to them than they do for other people. So respect that. Some of them want like firm, consistent pressure that's just slowly integrating different physical structures at a time. So it's like, okay, they've had a chance to process each structure, each bit of pressure slowly over time. You try to do something fast, do rocking, it's too much, or anything pokey can be too much for their nervous system. Some prefer lighter touch, and some think that the lighter touch is too tickly and it ain't right. So make sure they feel safe. Just ask about all their preferences and be ready to make adjustments. Cerebral palsy is another example of clients with disabilities that we might be working on. I've had a few cerebral palsy clients, and their muscles can be pretty spastic sometimes. So we just need to be aware of that and just be like, okay, that's just part of it. And then we're just going to do our best through the massage to help them take deep breaths and relax. Positioning can be really important for people with cerebral palsy. Be aware that for clients that have contractures where the muscles have shortened permanently, they didn't ever have a chance to grow to their full length, you're not going to be able to do the same kinds of range of motion treatments with some people with cerebral palsy that you can with more typical clients. So be aware of that, be cautious, don't pull too hard on their muscles, and keep those communication lines open. So athletic massage or sports massage for athletes and people that are active or people that have had injuries. Sports massage is really great for injury prevention and for recovery, and it also helps with performance. So before an event, for sports massage, use more stimulating techniques. I like to use a lot of quick petrissage, so it's like stimulating and wakes the muscles up before a performance. And then for recovery, I go slower, I go deeper, I go more relaxing to settle the muscles down. So post-injury recovery, we want to improve circulation and flexibility. We want to cool the muscles down. Hydro is really great for settling things down. So if someone's had an injury and they're still in the acute phase, like still swelling, there's still heat, a very short amount of time since the injury. You want to avoid that. Just put ice on it and work around it only after you've had medical clearance or it's been a nice long time since the injury and they're not experiencing a lot of intense heat, inflammation, and so on in the injury. Only after that, then you can use deeper techniques. So keep it gentle when those muscles are recovering after an event or an injury. So let's look at clients with specific medical or chronic conditions that we might come across in our practice. Oncology clients, that's clients that have cancer or clients that are recovering from cancer treatment. When a client is having cancer treatment, when they've been cleared by their physician for massage, massage can help with anxiety, it can help with pain management by relaxing the body, and it can help with their fatigue. But make sure you have clearance from their oncologist, from their physicians, about what days are safe to provide treatment after each radiation or chemotherapy treatment. That's really important. And make sure and use very gentle pressure and avoid recent surgical sites. Avoid areas with tumors or any kind of radiation burns. So just like with all of our contraindications, make sure to check out the video that I have about contraindications. Any place where there's an injury, we avoid as body workers, massage therapists. Closing, when it comes to our oncology clients, make sure that you get clearance from a physician before you treat them. Just be like, I really do want to massage you, but I have to have clearance from your physician first before I can treat you. Okay, so just for your own safety, this is the way it has to be done. And they'll be okay to wait just a little bit longer for clearance from their physician first. Okay, so clients that have chronic pain like fibromyalgia, massage eases muscle tension and helps with relaxation, which helps with pain management. So once again, just like I explained in the benefits of massage video, we're not, as massage therapists and body workers, we don't treat pain, we don't cure pain. We help with a pain management protocol by working with the muscles to relieve the muscle tension that could be causing the pain. And as a byproduct, the client will feel less pain. But massage doesn't cure pain. So we want to make sure and get that out there. When you're doing your advertising in the future and you want to mention pain relief, you're going to get a bunch of flags from Google or from Instagram about how you can't say that. We don't do that. We support pain management. So easing muscle tension, reducing stress and anxiety are always going to end up as a side effect. You're going to end up feeling pain less and also through touch. The pain gate theory distracts the nervous system from the pain. Essentially, the receptors for pain can't get through because all the receptors have been used up for sensation that happens from having the healing touch. So use light soothing techniques for people with chronic pain. Check in frequently. Every client's pain tolerance is different. And if you use too much pressure, if you're too vigorous, there's always a risk of a flare-up happening as a result of the body becoming stressed. The stress response sometimes kicks up. For example, for myself, I tend to work a little bit deeper and more vigorously on people. That's just kind of the way that my technique works. So I'm really cautious. I slow down and back up when I'm working with people with fibromyalgia and chronic pain. When I work more vigorously, it kicks up an inflammatory response, which is good for people with chronic tension issues that have numbed out the pain. They're like, oh, it aches, but they're distracting themselves all the time. And so I hope I'm getting this across right. They've numbed themselves to the pain. And so I use inflammatory techniques so their nervous system focuses on that, helps to accept it, helps to integrate it, and it helps to reduce pain in the long run and increase mobility and circulation in that chronically tense muscle. That doesn't work for people with fibromyalgia and other chronic pain issues because it will kick that inflammatory response up. And in the short run, at least, they're going to be feeling more pain and they're going to blame you for it. So be careful with people with those kinds of issues. Cardiovascular conditions, as I discussed in the contraindications video, massage can help lower blood pressure through relaxation, but in the short run, you are increasing, especially if you use deeper tissue techniques, you are increasing blood pressure in the short run. Okay, so for people that have high blood pressure, avoid using deep tissue work, avoid vigorous techniques, know your contraindications, whether or not that client is having their blood pressure controlled at this moment on any kind of medications to control their blood pressure. That will help you to be able to use a little bit more vigorous techniques, whether they have blood clot risks and whether or not they've had recent heart attack. So make sure and get that thorough health history for people with cardiovascular conditions and know what's contraindicated and how to adjust. Diabetic clients. So, of course, always be mindful about whether or not they're starting to fade when you're on the table with them. When I have a diabetic client that comes in, I'm like, if at any point, well, I start with metabolic changes can happen in the process of a deep tissue massage. So if at any point you start feeling lightheaded or dizzy, let me know right away so that you can do what you need to do to get stabilized. So I always have that conversation with a client that has diabetes right away. So yeah, watch for signs of hypoglycemia, avoid deep work in areas with neuropathy. With your diabetic clients that have had diabetes for a long time, that increases the chance of neuropathy in their hands and in their feet. They'll say, my feet are aching and I would like to have some deep tissue pressure on my feet. It's like, oh, and you're diabetic. I gotta be careful with that because you may not feel it. You may not feel the pressure that I'm using and I could be injuring you. In addition to that, the blood vessels get a lot more fragile in the hands and feet because of poor circulation. So you could actually really injure them using deep tissue. So I would say I have to use less pressure on your hands and feet. That's just the way it is. Clients with autoimmune diseases, lupus, rheumatoid arthritis, and similar conditions can benefit from massage because it's relaxing, calms the nervous system, reduces cortisol, which reduces inflammation. Avoid massaging flared up areas when they're having an actual episode. Avoid massaging those areas. Avoid direct work on inflamed joints. For people with those issues, use gentle supportive techniques for people with arthritis. Sometimes they'll have some joints that are more arthritic than others. So they'll have a lot of tension in their shoulders, but they're having a flare-up of arthritis in their knees. So I would use deep pressure on the shoulders, and then I would be more gentle and smooth around the legs to help relax the muscles in a more gentle way without inflaming the arthritis. People with neurological conditions like Parkinson's or multiple sclerosis, there are specific contraindications for each of those. Make sure and check out that contraindications video. Don't overstimulate them. Keep things really relaxed. Especially for clients with multiple sclerosis, you want to be really careful with hydrotherapy because of the loss of myelination on their nerves. They can be a lot more sensitive to temperature fluctuations. So be careful with hydro with people with MS, and make adaptations for clients with Parkinson's that are having spasms or tremors on the table. And if either have mobility limitations, just try to be adaptable for them with bolsters and such, and lowering the table, make it easier for them to get on and off. So that's the same thing for any client with mobility issues, having to make adjustments on the massage table to help them to be able to get on and off of the table and help them sit up and stuff like that. So geriatric, mobility, and clients with neurological issues. So respiratory conditions. Okay, be cautious with positioning for clients with respiratory conditions. Some clients may not be able to lay prone when they have trouble breathing. And so you might need to just do a sideline massage for the whole thing. Or you might need to just do your very best with a just lying supine massage. I've had plenty of those where I just massage somebody laying supine and just help them relax, stroke their shoulders, held their head, gently massage their hands and feet, for people that are having trouble with laying in a position that is comfortable. Okay. Clients with recent surgeries or implants. I just recently had a client that had a significant surgery on the abdominal area, and they came in expecting to have a table massage, but they were like, yeah, it's really hard for me to lay down at all, and I really would like to have some deep work done on my shoulders because I'm really tense after having had this huge abdominal surgery. So I just set up my massage chair for them, and I gave them a good solid shoulder rub, and they were super grateful. So make those accommodations. Make sure that your client has had clearance from their physician after a surgery to get massage. So the physician might say, okay, but only in specific areas. Okay, but only in this position. No, not at all, because of the pressure on your circulatory system until later on. So no, not now, but maybe later. Just get that permission from the physician after a significant surgery or having an implant done. So let's see, orthopedic implants, like say someone has had some implants set in on their hip or their knees or their shoulder. Once again, physician approval if it's really soon afterward. I have had clients that had their implants put in several years before. So it's not a matter of getting permission from the physician, but instead it's a matter of clear communication with your client about exactly where it is. Can I gently palpate to find out exactly where any bolts might be? Find those, avoid that spot because that hurts. So make adjustments, get feedback. Mental health considerations. So I have had clients with severe anxiety, post-traumatic stress disorder when it comes to being in a vulnerable position in a massage room alone with another person, even with a female, which you would think that there would be less of a chance of trauma, but it still can happen. So make sure that you're sitting at their level when you're doing the intake and asking open questions or looking for open-ended answers so that you can get as much communication from them as possible. But that will help those clients feel safe in your presence for treatment. It's like there's part of them that wants this treatment, and then there's this subconscious part of them that is afraid of the vulnerability that comes with it. So just make sure to have that conversation and make it very clear to them at any point. If you start feeling stressed, we can stop the massage and we can pick it up again, or we can just be done. You can come back another time or never come back. It's up to you. This whole process is under your control. You're the boss here. Okay. So clients with depression and clients with anxiety or post-traumatic stress disorder can benefit greatly from massage therapy, especially from relaxation massage. It increases serotonin and endorphins, which feel really good, which help perk them up. It helps them to feel more relaxed in their bodies, and it decreases cortisol, which can lead to all those stressors that cause the mental health conditions. So yeah, adjust the session length if you need to for clients that can't be in that position for very long. Meet their energy level, wherever they're at. Meet them where they're at and accept them. Show them that you accept them. Okay, immunocompromised clients. I've had some that were like, all right, I need you to wear a mask. Okay? Stuff like that. Clients that are undergoing cancer treatment, we were already talking about that. Clients with HIV or other immune suppressions, like they are taking immune suppressants for an organ transplant and stuff like that. The massage can ease the stress for these individuals, but you have to be super careful to use light pressure to prevent the inflammatory response from kicking up, and be so strict about hygiene. Wearing your mask, making sure your hands are really clean, everything's like really sanitized around the room. So if one of these clients has booked an appointment, I would be extra thorough about sanitizing everything that I possibly can in the room, within reason, and being very accepting of them wearing a mask and making sure that they have access to a washroom to be able to wash up afterward. Lymphedema. So I've had a few clients that had pretty severe lymphedema. And when I say clients, I have to clarify that I am not certified in manual lymphatic drainage. So when those clients came in, I had to be very clear that I'm not going to be working on your legs. You need to be going to get this kind of treatment, and I refer them to a couple of acquaintances that I have that do specialize in manual lymphatic drainage. So if someone has lymphedema in their arms or legs, those parts of their bodies need to be treated by those specialists. So I don't work on arms or legs for people with lymphedema, but I will accommodate their neck and their shoulders because they can have a lot of tension in there. So depending on your certification, when you're taking the MBLEx, asks you a question like, your client comes in and says they have lymphedema, and what kinds of questions are you going to ask, right? Ask about, can I get a look at your leg then and see the degree of it? And then you press on it, you see the degree of the lymphedema, such and such. That might be some potential questions and answers that you'll get. And then how are you going to respond to that client when they say that they would like to have deep tissue work done on their legs because their legs hurt, How are you going to respond to that? In those kinds of cases, they're looking for you to say that you would refer them to somebody that is certified in manual lymphatic drainage to work on their legs. Okay, so end of life and palliative care for those of you who might end up working in those kinds of situations. We're talking about the MBLEx specifically. There might be some questions about how palliative care is different from a typical massage. And so it's all about reducing stress, bringing relief, reducing cortisol, like bringing relief. Physical relief can help reduce anxiety associated with end-of-life care. Keep the sessions short and adjust the pressure and positioning because it's not necessarily a priority for them to get deep tissue work for mobility or releasing adhesions. Their priority or your priority should be just about reducing anxiety, essentially, and making sure that they're as comfortable as possible. So for clients that have been immobilized through hospitalization, bed rest, or they've been in a cast, or they've been injured, so they've had to not be mobile as much, when they've been cleared by a physician for massage, you're going to see clients that have muscle atrophy, joint stiffness, bone density loss, circulatory issues. Their soft tissues, their muscles might be short in specific areas, especially the hip flexors, and the pecs are going to end up being short. And then they'll have some psychological impacts of not being able to get out and about. So you can assist by improving circulation to those areas, relieving tension, and slowly increasing mobility. So slowly over time, building up, you might be working on those adhesions, you might be working on lengthening those tissues over time, okay? Now this is not the same as working with people with disabilities like cerebral palsy and being like, I'm going to lengthen the muscles in your legs, and which might end up injuring them. So just be super careful, use communication. Don't take them more than like a 5 out of 10 when it comes to sensation and the work that you're doing for helping them with the effects of immobilization. And once again, we were talking about geriatric clients and what kinds of effects aging has on the body. So I'm going to go over this one more time. Muscle weakness, which is called sarcopenia. We were talking about muscle and bone degeneration in the last video on medical terminology. So muscle weakness, joint and cartilage degeneration, osteoporosis. Osteoporosis is where the bone is getting little pockets, little holes in it, so the bone can be really fragile, especially in the hips and low back. For our aging clients, their skin gets a lot more fragile over time because of a loss of collagen production. Also, muscle degeneration is part of that as well, because as we get older, it's harder for us to build muscle mass. Reduced circulation is part of aging. Slower reflexes and sensory loss, which is really important for us to have communication with our clients about what they're feeling, especially in their peripheral areas. And then there's the emotional and social isolation. So I've had a few older clients that want to talk the whole session, and I let them. I ask them questions about their preferences and what makes them happy. And I try to keep the conversation light and happy through the whole thing. And they love it, right? It's great. There's nothing wrong with chatting through the whole massage, because you don't want to be using too much pressure anyway on our aging clients. So let them chat it up, because they might be isolated and you are their access to the outside world. So just, honor their bodies where they are and support their dignity in where they are in their lives, and make sure and support their bodies with really nice bolstering and keeping them comfortable. So in conclusion, all of our clients have a unique story. All of our clients are special in their own way. And being able to accommodate clients that have all kinds of situations going on with their bodies and with their lives really brings a rich experience to your practice. It can be really gratifying to be able to work on all these different kinds of people, all these different people. It's wonderful. So thank you for joining me on this exploration of special populations in massage therapy. Make sure and get your free stuff. Check out some of my paid stuff that I have that will really help you to be able to pass the MBLEx easily. Give you a lot of great confidence at the very least, which is a huge relief in the lead up to taking the massage and bodywork licensing exam. Make sure and subscribe if this is content you love. If you like my style, please give this video a thumbs up. I'll see you guys in the next one. Toodaloo.